surgery.
And another happy Tuesday.
Yeah.
We're here with you.
Lisette here. Thank you for being with us again.
Yeah. So we wanted to give everyone a thanks for the breast cancer walk. Everyone who was supporting us, everyone who went there and walked with us, for those who donated on behalf of Dr.K Plastic Surgery. If you haven't seen a recent post, you really missed out. It was so much excitement and everything, yeah, all the energy there. It was great, and we want to thank you all for being a part of it. And of course, it's never too late to donate. We still have the link up for the month of October for Breast Cancer Awareness Month. So if you have any questions, just DM us.
Thank you so much for participation, for being there. Very good.
And we'll wait for you to sign up for next year. We'll be doing it again. We've been doing it for over 7 years, so we look forward to next year. We'll be getting ready and prepared months ahead, so it's coming up for next year. Today, we'll be talking today about fillers and changes that you can have done on your lips or laugh lines with fillers, also Botox. If you have any questions, go ahead and send us any questions you may have.
Yes, just post your questions, including for Botox fillers, for the lines everywhere, and anything else regarding the plastic surgery. We are here. So we start with that topic of the Botox filler, and then till we get the rest of the question as well. So, you have a question, or should I say?
I think we can get it started a little bit. I see people tuning in right now, so I'm just waiting for the questions to start coming in, and then I think we can get a little bit started on what fillers are.
Technically, when we're talking about the fillers and Botox, that's the time mainly we're talking about the lines and wrinkles in the face area, the facial area. So it's very important to know these two products are totally different, and they're not substitute for each other. Sometimes they work hands in hands, they work together at the same time, but the mechanism of the work is different. For the to have a better understanding of how they work, we should have a better understanding of how the lines, we get the lines on face. So Liz, let me ask you questions. When we're talking about the lines, it's a quiz test.
Quiz.
A quiz, all right. So the lines on the face, we have two types of the lines. So do you want to tell us, or do you want to
The nasolabial fold?
That's one of them. That's the name of it. What kind of the lines?
The laugh lines. Yes, so people know them more.
Yes, they call it laugh line as well, as smile lines. But I wanted to say it in a different way a little bit. Any lines that we see on the face, they could be because of the muscle actions, or when the muscle starts to work, we have them to work, then we see the lines, or when we have the face flat and we're not moving our face, and we're relaxing, it looks like we're slow by the pool laying on the back and with the sun, and still we see the line. This is not good. You get the lines with that. So those are different lines. Those when the facial muscles are not in action and we see the lines, we call the static lines, or the lines that in a static and no motion still we can see it. They are different from the lines that we get it when we get the muscles into work, and those are called dynamic lines. Now, give me an example of the dynamic lines. Just exactly.
Those would be the ones when,
give me some
like
chilling
the
point, yeah.
Here we have like them
between the eyebrows.
Yes.
Between the eyebrows.
Yeah, I had my Botox, I cannot do the scalping now.
Or the crow's feet.
Exactly, those are another dynamic lines, because when you start to smile, the lines here. Or when raise the eyebrows, we get the lines on the forehead. So these are the dynamic lines when they get the facial muscles to work. So they can be treated with Botox mainly.
Right.
Because again, one more explanation about the difference between the Botox and fillers. Botox is going and relax the muscles. Botox is a toxin, technically. It's gonna relax the muscles temporarily. It's not permanent. That's a good thing about that.
I have a question here.
Yes.
Someone Cat Cook is asking, does Botox work for sagging jowls?
Sagging jowls?
Yeah.
No, not at
No.
all. I'm sorry.
Oh.
No, the sagging jowls is usually we start to seeing it maybe age of 30, 35 or
Okay.
above. And those are the areas, it depends how much is sagging. So Botox is not a treatment for it. No, not at all.
Maybe
Good question, by the
facelift.
way.
Maybe
That's good.
facelift.
Okay.
Maybe a mini facelift.
I
Maybe
also
could be.
have Larry Fred. He says, how often can you have Botox for the face?
Very good question. Thank you for that question. Botox, you can use it every 4 to 6 months, and depends to which areas we apply it. It's been shown in men we have to use a little bit more of the Botox. It's been shown in men that's gonna wear off faster. So between 4 to 6 months depends on the different areas. But let me take advantage of this question. I want to give you a good hint that you shouldn't repeat Botox in the same area earlier than 3 months. Remember, nothing in that area. I will tell you in a second what's going to happen and why it's not good. With the same reason that I'm going to tell you, explain a little bit more, you shouldn't receive any Botox for the facial region and wrinkles more than 100 units in one session. So what happens if you repeat the same area? For example, I go and get the Botox for this area, and in a month or 2 months, I say, oh, it's not enough, it's coming back, let's go get again the Botox for the same area, less than 3 months. The body starts to make an antibody against that. The body makes a kind of the hormones that's going to kill the Botox faster. And is going to make the Botox ineffective in the future. Or if you get 100 units, more than 100 units in one session, you might say, why? Some people, they come and get a Botox here, get a Botox here, get a Botox here, some Botox here, all have the indication. But when you go above 100 units in one session, again the body starts making the antibody or some hormones that killing those Botox that is gonna deprive you of using the benefits of the Botox in the future. Very good question. Every 4 to 6 months is very good, but don't repeat it in the same area in less than 3 months. I mean, you can get the Botox for this area. In 2 to 3 weeks, you want to get another area, is okay. You want to get around the area, is okay, but not the same area.
And I think we have like some patients after they have the Botox. I know a common question that they ask you is, can I move it now, or do I have to stay frozen? Like, what do I do? Like,
good question.
I just stay.
Yeah.
But
So,
that's, I mean, that would be my question.
Yes, I mean, it's very, very common. I mean, I would say one of the myths about the Botox. The people say, okay, if I get the Botox in this area, not to move it.
Right.
It stay frozen, like the iron ice people. Theoretically, actually, it works better the other way around. If you start to move those muscles, get those muscles to work, you're gonna distribute that toxin, the Botox. I mean, you're
I
gonna
also want
distribute
to say
more
that
in
it's
result.
preventive too, Botox.
Yes.
Like when someone's on the younger side and they want to start using Botox to prevent a permanent line, because once the permanent line is there, it's very difficult to treat.
I agree and disagree with what you said.
Okay, well, that's what you said over here.
I mean, I agree with you in terms of, we have seen the people, they have a permanent line here. I mean, without using the muscle, the line is there. Yeah, those people, they were supposed to start a little bit early. They were supposed to start before they get to the aesthetic line. They have to have the Botox. But I don't want to send a message out that's a prevention, like we get the vaccine, not to get the
Right.
Like, it's not like a flu vaccine. Okay, I go get the Botox not to get the wrinkle in the future. No, because the Botox is gonna wear off anyway in 4 to 6 months. I cannot start, and I don't want to send a message to especially the younger group, age of 16, 18, especially with the media. Say, oh, I'm gonna start to get the Botox at this age because I don't want to at age of 30 get those right. No. Just wait for that. If it comes, the early sign, then it's time to get it.
And also, people know how strong your muscles are. So if you're always making those gestures, or like when when the sun hits, it's automatically tend to do that. So people know what muscles on their face are very strong.
I think the only people they know how strong is the kids. They look at their mom when they're scowling on them.
Oh, that's true.
The kids, stay under sun. How strong it is.
Very strong muscles.
Good.
Do you have other questions?
Yeah, so I think this is kind of going to the next topic that we have. Someone is asking, when is fillers needed in comparison to Botox? So I think people need to know like the differences from with injections, Botox and fillers.
Yeah. So for that question, the filler, when your face is not moving, is not in action, in rest position, and you see the lines. I'll tell you, the main areas is smile line here, or we call that in medicine nasolabial fold, is a medical term for it, is a fancy name for it, but it's just a smile lines. These are the lines. We can use fillers a little bit later or older. The lines here, we call it the marionette lines. They are really good for those areas. There are some areas on the teardrop or right under the eyes. Some people, they have very sunken eyes, and mostly we can see it on the lower eyelid. So this is the area to fill it up. Some people, they call it as a dark eyes. It's not fillers, they're not changing the skin color. Actually, they might fill them up and get a more light reflection, though it doesn't look like as dark as much. The best example, when we look at the moon, we see the lighted area and the dark area. The more lighted are the areas they have more light projections. They are the mountains on the moon, and the areas which are dark, those are the valley. We get the less light reflection. It's the same mentality. When you're working on the dark eyes around the eye, when you fill them up, you get more light reflection. It looks less darker, but technically filler, they're not changing the skin color.
It helps a little bit, right?
Yeah, it does, definitely. And one of the good things, I'm sorry interrupting you, is fat. Transferring fat from this area, because we're talking about under the eyes. Yeah.
Oh, okay, yes.
Is that the body
And
we're
then
talking about?
that's the other thing I wanted to talk about. What is the most suitable permanent filler? And I wanted to ask you that because I know that a lot of patients go and have fillers with nurses, which is perfectly good. Also with dermatologists, and of course they do a great job too. But they're not going to really offer a procedure for the lip injections, which is with fat transfer.
Yes, that's right. Fat, we shouldn't look at it as a permanent filler, not at all. But but it's gonna stay longer. And the good thing about the fat, today we are conflicting with each other.
I love it.
We always do all the time. Anyway, this is like what really happens every day.
Yes, good things happen in the
And
conflicts.
Crystal then comes and kind of
to calm it down. Yes, the fat is really good because of I really like it because of the color match more than anything else. And the consistency of the fat is natural. You can get it from the other part of the body and then put it there in the other part of the body. However, when we transfer, we're not transferring grease, we're transferring the fat cells. And some percentage of those fats are gonna stay. However, I would say, because keep in mind, even with 100% of the fat with transfer states, if we have a magic way to make sure 100% of every single fat cells will transfer to stay, and over time those fat cells by aging process, they go away, some percentage of it. But in general, it's really good. One of our patients actually, for some reasons, she had very depressed temporal area, and we used different fillers, different layers. However, when we started to do the fat transfer, after 2-3 years, I think after 3 times, stay for good. Stay for and years she kept it.
Yeah.
Crystal, you have something?
yes.
I do. Someone has a question, and they're saying there's so many products in the market for tightening.
Yes.
I believe that none of them work. Am I wrong to think that the only permanent and efficient way is facelift?
If there is indication for facelift, if there is a time for the facelift, yes, this is the only efficient way. I mean, it looks like you want to build up a house, you have to have the foundation.
Right.
If you make the foundation correct, then you can use the other tools. You can put a very nice paint on, on the house, beautiful windows, doors, but when the foundation is not right, it doesn't make sense to do the other things. But keep in mind, not everybody needs a facelift. No, it's still a lot of years we can cover those, and we take care of the your beauty with the fillers, with the botox, with the different products. Don't miss the skincare products. Very important. Remember, our skin is the organ which is exposed to environment. We are exposed. We have our skin exposed to the sun, all pollutions, and maybe we take care of it. The rest of the other organs. Yes, maybe because every single second this organ is exposed to the pollutions and everything. Okay.
And can you please explain why we need fillers? Because a lot of people think, okay, that's gonna help lift. No, it's actually to replace the fat that we've lost, right?
Yes, replace and by passing time in the aging process, the skin is gonna get thin. It's gonna get thinner. We lose the volume in terms of losing the fat. We lose the bone, but we're not gonna replace the bone. But whatever we can replacing is really good, and at the same token, taking care of the skin to make sure keep the thickness of the skin is very important to keep the defense mechanism of the skin against the pollutions.
Yeah.
And as far as fillers, like she said, there's a lot in the market, and it's very difficult to decide. There's a new one called Versa 2 that you've tried, but for lip fillers, I think you most of the time go with Juvederm, right?
Yes, I use Juvederm. I use Restylane. I use Versa. All of it. Mostly, I use the. These are all called HA products, which is abbreviation for hyaluronic acid products. These are really good, but for different purposes, and it's very important the injector, the doctor or the nurse or physician assistant, whoever use that, be familiar which one to be able to predict the result. Keep in mind these syringes, these products, they are not determining the final result. The person who is using that is determining the result.
Right.
And I always make example for some of the patients. Should I go with this or with that? I would say just find the provider you can trust, and just go with the advice. For example, if you get me a vial of the penicillin, okay, if I want to inject a vial of the penicillin to the patient, it doesn't matter who inject, as long as registered and it's legit person to inject. Could be a doctor, could be a nurse, could be a physician assistant, intern, resident, where the result is there. The vial of the penicillin is gonna determining the result, but the filler by itself is not determining the result. It matters who is injecting for you, who is using that for you.
I like that example too.
That was good?
Yeah.
Is it clear now?
So I want to take a quick break and just say hello to everyone that's
Very
been
good,
commenting.
yes.
So I'm trying to keep up, so you just keep commenting, keep sending your little hearts and everything. Send your love to Dr. K. We have Gladys E. Jimenez. She was the one that asked the question about the tightening.
Oh, yes.
We have Salty Second here. We have Larry Fregg.
Larry asked a question about how often we can use Botox.
Yes,
okay.
yes.
You see, my memory is not that much bad.
Are we still? And then we have Yahida. We have a couple of other people. We do have other questions that's not within the injectables.
That's okay.
Topic. So
Yeah,
that's the whole
move on
purpose.
to that. Okay,
yes,
great.
anything.
So
Yeah.
someone is asking, can I have lipo done on my calves?
Whoa. It is a live presentation. I would say be very careful for that area. You should be very careful about that area.
It's mostly muscle in that area.
Yes,
right?
it's muscle, and I would say no till you be examined, because I have not seen you, I have not examined you. Maybe you are perfectly be a case for that, but in general, liposuction of that area is very dangerous, and it should be done when there is a right indication or not. So I'm leaning towards the same.
Board-certified plastic
Of
surgeon.
course, find a board-certified plastic surgeon. Let the
Very
person
important.
examine you. Let the person make your final decision about that. Then, yes.
Well, I'm
Yeah.
glad they came here to ask you,
Mm.
and
Yes.
because I know it's something that they might not get the answer somewhere else. So.
And
Okay.
All
Alright.
I also want to say we're open for suggestions. If there's anything you want us to talk about, go ahead and
Yes.
let us know.
Oh yes, you can
Yeah.
through the social medias or emails or our website, anything. You can say, I'm interested about this topic to talk.
Yeah.
Even you don't have any specific question, you're more than welcome if you have any
If you
specific
have any
question.
questions you want to do privately, you can email me at team@DRK Plastic Surgery. We'll go ahead and add it on the comments so you can email us.
Or you can see it on the Instagram profile. Like there's a call button, the email button. Am I
Right.
Yeah.
Yeah.
Okay. So then you can
It's
see it.
team, but it's privately goes to her.
Everybody sees it though.
Yeah. So someone is saying hello from Kosovo. I don't know.
Oh yes, that's
You know,
yes,
where is
exactly.
that? I don't.
Actually, wow, it's going back to maybe 20 years ago. There was a war going on there.
Really?
Yes, that was
Wow.
the center of attention for the whole world.
Where
I
is
remember
that
that.
exactly?
I'm
Is
looking
in
at the
Eastern
questions for the
European.
phone.
Yes.
Oh,
We get into
okay.
the politics now. No, we're not gonna get there.
I know, we're not gonna
Like
get to the
I'm on my
politics
phone.
side. But
Yes.
thank you for sharing where you're from. Everyone just keep commenting. Someone is going back to the injectables. They want to know what age do you recommend to start using Botox?
Nothing earlier than age of 18, 20, and it should be, and at that age usually you don't need that much, other than there's a specific situation. Yes, nothing earlier than that.
So you lose volume on your lips as you age too?
Yes, yes, you do, and you get the involution. They go inside. I mean, you have to just put them out. Yes, to bring them out. Yes. I mean, the red part of the lip, it gets involuted, gets
Oh.
tucked in
Mm-hmm.
by losing your volume. But just restoring the volume is gonna show itself. Okay.
Okay, is there a way to reshape your lips so that they look more feminine? This is a question.
To some degree, yes. To some degree.
I think everyone wants the Cupid's.
Yes,
bow.
to some
Mhm.
degree, yes. It's very meticulous. You should know what's the limit. You should know not to push the envelope because the enemy of good is perfect, but they have a different line. The enemy of perfect is good enough. It's contradicting, yes, but yes, the answer is yes. It's possible to some extent. Yeah.
I have FAD, FADWAID, FAD.
Uh-huh.
I'm so sorry if I'm not pronouncing it right, but she's asking, wondering if fat can be transferred from another area to the breast instead of using implants.
Yes, that's actually, we had a patient today. I mean,
Yeah,
we had
we
a
did,
consultation, and for that, it's possible. It's really good. It depends how much volume or enlargement you're expecting to do. For the moderate enlargement, and depends on how much fat you have, it's possible. Be ready to repeat that process. Is a process that you might need to repeat, like a fat transfer to anywhere else.
Exactly.
That you're gonna lose some of the fat, you need to repeat that, but yes, it's possible.
also good for patients who have a lot of thin skin, right? Would that help with
Yes.
camouflaging the let's say the ripples?
The ripples, but yes, I mean, those thin people, they don't have that much soft tissue coverage. If they go with the implant, especially if they go with the saline implant, they have a higher chance to show the ripples. But instead of that, they can go with fat. Yes.
Or both?
So,
No?
I don't do it at the same time. I don't do the instructional fat transfer at the same time with the fat.
Mm-hmm.
I do stage that to not to combine. Especially we have an implant, we don't want to increase the chance of infection around that with the fat transfer. You see, we're conflicting with each other. Another but in the best interest of you.
No, but it's good because somebody might have a question you have.
Yes.
Somebody
This
have
is
a
the
point that
reality.
you have. Yeah.
Yes.
It happens.
I have one more from Larry Frank. He's asking, how safe is abdominal liposuction?
It's very safe.
Yeah.
Is
Well, in the way that you do it.
yeah,
it's very
yes.
safe,
I mean,
yeah.
it's very safe, but again, that's a good time. I mean, in the bracket, I have to say, fortunately, the complications in plastic surgery is very low. It's almost nil. but still it's a real surgery. So everything should be done. Again, make sure to find a board certified plastic surgeon wherever you go, and then do have a good exam with your plastic surgeon ahead of the time. And when is everything have been calculated, it's a very safe procedure. You do that a lot.
We have Miss Shakila commenting here. She's saying, "See you tomorrow, doctor. You are the best."
Oh, thank you
Coming
so
in
much,
tomorrow.
Shakira. Thank you,
Shout out to Shakila. Thank you.
Oh, yeah.
Thank you. Everyone
Thank
loves
you.
coming to see you, Dr. K. Do we still have? Okay, we have a couple of minutes. We wanted to talk about, if we can, about the Zeo Skin Health
Yes.
event that we have this Thursday, right?
At 5 p.m.
Yeah, so this
This
time,
week?
yeah. So
Am I invited?
Yes.
Of
All
course.
right.
Definitely.
Yes.
Well, this
Okay.
time it's a little bit different in the hours. It's a little after hours.
Yes.
Um,
We're gonna be here till 7. So
Wow. Okay.
yes.
We're
Dr. K will probably be here too. He will definitely be here
Yes.
at 5. So if you want to see him, come here on time and
Yes,
be here at
please.
5.
Yeah.
If you have a few questions regarding plastic surgery, he can answer a few. But we're mainly going to focus on the skincare. We're going to do
Sure.
free evaluations, and we will have a raffle going on.
Wow. All
So
right.
you can
I'm
see
gonna be
that.
there.
Yeah.
I'm gonna sign up for
A
that.
basket full of the Zeo products.
Okay.
But one of the main things that we are showing is the stimulator peel. So for this one, it helps with fine lines and wrinkles, as well as the texture of your skin, dark spots like the sun damage, or hyperpigmentation from acne scars. So if anyone's dealing with that, you just come in and get the peel. You just feel refreshed. I'm probably gonna.
Yes, it's a brightening peel too. So, like she says, it helps with now that we're in winter time and the holidays are coming. We want to get our skin ready, and so we have a lot of sun damage from the summer if we were laying out. So this is perfect time to get a peel and be ready. You're not going to peel excessively. It's going to be a little bit of exfoliation of the skin. But we will continue a regimen. You'll know exactly what is recommended for your type of skin.
But then you need to peel a little bit.
Yeah, of course. Yeah.
If you
A
don't,
little bit.
if you don't peel, you don't see the result.
Right,
Yes.
right.
You
But
have
this
to-
is not a very aggressive peel,
Yeah.
so we're gonna start our patients with this peel so that their skin is ready to absorb the products.
The
Right,
products,
We're gonna
yeah.
start, yeah.
So just come by, get your skin evaluated. It's going to be accustomed to whatever it is that you're trying to treat, right?
Wow.
And one thing's for sure that we like to tell everyone when it comes to these products is it gets worse before it gets better,
Yes,
right? So
yes, so you
just
have to have
keep that in mind.
patience.
Are you gonna take care of us with some cookies and
Yes,
Yes,
that's
you're
it.
gonna
We're
have
gonna
a
do
person?
some
Appetizers.
refreshments,
Okay, here we go.
Appetizers.
It'll be fun.
I'll be there.
Yeah, so come join us.
We'll
Just-
have food.
Yes.
Very
so-
good, very
Yeah.
good. Okay, I think before the IG kicks out, we have to say bye. Thank you for following us.
Thank you.
everyone.
If you
Yeah.
have any friends that are interested in skincare, just let
Bring
them
them
know.
alive. Yeah, that's cool.
It's gonna be fun.
Yes.
All right.